Hi, I'm Karrie Velky, and I just wanted to show you how to use the Pink Petal. You can use it on any saliva ejector, whatever saliva ejector you use. It simply slides on. When I do my room setup, I just leave it like this. I have my suction ready to do whatever I need to do. Then when I'm ready to use my Cavitron or ultrasonic scaler, you bend the suction tip. The bend is the most important part. It needs to be bent in a U shape. If it's not bent far enough, it'll be flappy on the cheek and it won't hold it nice and tight. So then just bring it around and flip it so that this is going to be on the cheek side. It goes right into the mouth. It protects the patient's cheek from being sucked up into the suction. It holds your suction tip in place. The patient can still close their lip around the straw. And then when you're done, you simply just unkink it and you have your regular suction back to finish your appointment.